Hi everyone, this is Ruth. Most of you know me as the dental hygienist and therapist at 07 Dental in Farringdon. I know you're used to seeing me usually behind a mask in the dental practice, but today I'm coming to you from my home in North London. I have a little helper who's running around and she's keeping me very busy during this time. I hope that you're all keeping well and keeping safe during this time of deep uncertainty. We just wanted to let you know that we're thinking of you and just want to help out in any little way that we can in this period. There's a few things I'd like to talk about. There's three main tips that I would say to help maintain your oral health. The first would be your toothbrushing. We want to make sure we're doing that twice a day. There's not really room to do it less, and now that we are all at home all the time, hopefully we have more time to focus on that. It only needs to be for 2 minutes. You don't need to be spending much more than that, but you really can't spend less. The two options would be your electric toothbrush and your manual toothbrush. I would generally stick with the electric. I was actually quite surprised to be able to find a manual toothbrush in my house because I just don't use them at all. As I say, the technique is the important part, so just making sure we're getting that right. Unfortunately, I don't have any models at home, so I'm going to use my hand today. So we're going to pretend that my hand is your lower teeth. We're going to get our toothbrush and place it half on the tooth, half on the gum, angle in at 45 degrees, and just do nice little circles so we're gently massaging our gums while brushing our teeth at the same time. That's very, very crucial. If you find that you're getting any bleeding when you're brushing this way, it's probably just because you had some remaining bacteria, some plaque sitting on the gum line, and now it's being removed. It's just irritating the gums a little bit. If you repeat that and do it every day for the next week, 2 weeks maximum, you should find that the bleeding resolves and there's none after that period of time. When we're brushing, we want to make sure that we're cleaning all the surfaces of the teeth. So we clean all the way around on the outside, all the way around on the inside, and the flat surfaces as well. And then we do the same for the top. We just, turn our toothbrush the other way, 45 degrees again into the gum line, and just nice little circles. Making sure we're cleaning the teeth individually. It's very easy to miss teeth out, especially when we're moving across our mouth and turning our wrist around in certain ways, but just making sure you're cleaning the teeth individually. And to be honest, it's very difficult to get that wrong whenever you're using an electric toothbrush, because all you have to do is hold it in the individual teeth and it will do the job for you. So same again, half on the tooth, half on the gum, 45 degrees, just hold it there and just move it, each tooth one at a time. With an electric toothbrush, you can't really overdo it. If you press too hard, the bristles stop turning around. This one has a great light on it, so we know we're being too heavy-handed. If we're brushing too hard, we're removing the enamel surface over time, and we're also brushing the gum away, which unfortunately neither of those things grow back, so we want to retain them, we don't want to damage them. When we brush too hard and it removes the gum, from where it used to be and exposes the root of the tooth, it can be very, very sensitive. And it doesn't look great either because that part of the tooth is actually a different color. And I think people are surprised by that. They think that their teeth are discolored when it's actually just that they're seeing the part of the tooth that they're essentially not meant to be seeing. Same again, we're brushing all the way around on the outside, all the way around the inside and the flat surfaces. And finally, with the toothbrush, you want to clean your tongue. You don't need an additional tongue scraper or anything like that. I just use my electric toothbrush. It's whatever you want to do. If you want an additional piece of equipment, that's fine, but just making sure you're brushing your tongue as well. So we're spending 1 minute on the top, 1 minute on the bottom, and that's it.